Sight is an important sense that we often take for granted. Reduced sight is indeed a reality for many, especially those with retinitis pigmentosa, a genetic eye condition which causes the photoreceptor cells of the retina of the eye to degenerate slowly and progressively. Of the few bionic eye models advanced, the Argus 2 system, developed in 2011, has proven most effective in replacing the function of photoreceptor cells. As a retinal-based visual prosthetic device, it has improved the retinal neural machinery and has therefore enhanced visual perception and the quality of life for those at the very severe end of the disease. Starting with the normal physiology of vision, a major component in the ability to see is the activity of photoreceptor cells. Known as input pixels, they act as transducers which convert light energy into neural impulses. Located at the very back of the inside of the eye is the retina, a light-sensitive tissue which houses photoreceptor cells of two different kinds. The first are rods, which are located in the peripheral regions of the retina and are stimulated by low levels of light. The second are cones, which are located in the central portion of the retina and are activated by high levels of light in order for us to perceive fine visual detail and colour. Now, how this all works in terms of vision, put very simply, is light will enter the cornea located at the front of the eye, passing through the pupil in order to enter the lens. The amount of light passing through is regulated by a disc-shaped structure called the iris. From the lens, the light is projected onto the back, the retina, where it is then converted into neurological signals. Now, to do so, the light will first hit the photopigments located on the discs of the outer segments of both the rods and the cones. This will then trigger a chain of chemical reactions which ultimately change the membrane potentials and propagate that visual signal to the bipolar cell with which the photoreceptor is synapsed. From the bipolar cell, the signal is transmitted to the ganglion cells, whose axons make up that optic nerve fibre. This visual signal will then travel through the optic nerve to the thalamus, specifically the lateral geniculate nucleus, and then to the visual cortex of the brain, where the brain will make out what we see. Now, for those with the retinitis pigmentosa, inherited either in these three ways, mutations in that gene responsible for the function of photoreceptor cells will cause rods and cones to break down. As can be seen in the stark contrast, here there is a disrupted visual pathway. Where there are damaged rods, the patient will experience night blindness and later a limited visual field. As the disease progresses, cones also start to deteriorate, and when this happens, patients experience limited peripheral vision and limited visual field, often described as tunnel vision. Now, recall that in a normal physiology, these photoreceptor cells convert light energy into neural signals. In retinitis pigmentosa, absent these effective cells, reduced sight is a reality. Indeed, the symptoms experienced by patients include the following: loss of central vision, inability to see colours, blurred vision, which can start as early as childhood. To diagnose retinitis pigmentosa, the optometrist will see black and brown pigment clumps on the retina and the surrounding blood vessels, which are normally orange and red orange and red hue in a healthy person. Other ways to diagnose these are the following: so colour vision tests, visual field tests, etc. And importantly, as Meribet and Reddy acknowledge, although there is this progressive degeneration of the photosensitive components, there remain some retinal cells intact, namely the bipolar and ganglion neurons, which will allow patients to respond to some electrical stimulation, which is important for those using the Argus 2 system to regain visual ability. Now, what is the Argus 2 system? Well, developed in 2011, thus far it has only been the treatment option for those at the very severe end of the disease. As an image capturing and image translating device, it has replaced those degenerative photocells using video images converted to electrical energy to stimulate surviving retinal neurons for the brain to relay and help perceive the world. The external components consist of the video camera, which is mounted on a pair of glasses for real-time image capture. You have information being processed by a visual processing unit and optical data being transmitted through this coil into the implanted coil, which is attached to the sclera of the eye. This coil acts as a receiver which converts radio waves into electrical signals. Now, connected to this coil is a light-sensitive array which is secured to the retina to allow a direct stimulation of those surviving retinal cells. Now, these visual precepts are then transferred as light patterns to the visual cortex of the brain for the brain to make out what we see. Now, while this doesn't replace normal vision, it has proven to help patients perceive, identify, and navigate through the world more independently. So we have distinguishing, interpreting light patterns, recognizing outlines of people, and moving more independently without the need for a cane or a guide dog. So this has obviously proven valuable to the physiological field, with Ferravaiden studies confirming that it has enhanced performance on orientation and mobility tasks needed for everyday life. It is obvious that this image processor and this visual spatial information conduit has proven effective for the physiological field, allowing patients to see life in a new light. Thank you.